Excellent. Good morning, good afternoon, everybody. Greetings from Johannesburg. My name is Dr. Samgeliso Dube, and I'm the Executive Director for FP 2030. It's so good to actually host this webinar, being joined by a very strong community of SRH advocates in Latin America. I hope wherever you are all well. So briefly about FP 2030, as some of you might already know, we are a global partnership who are focused solely on family planning foremost, and particularly on contraception. We are working to ensure that everyone, everywhere, including in Latin America, can access and use voluntary, rights-based quality contraception, no matter where they live, how they identify in terms of gender, their age, their ability in terms of social and economic status, and importantly, their partnership status. So we've done this work to date as FP 2030 was conceptualized way back in the London Summit for Family Planning in 2012, and now has transitioned to become this support network, which is made up of 5 regional hubs. So we now have a regional hub, that 2 of them in Africa, that is in Abuja in Nigeria, a hub that is hosted by Population Council. We've got another hub that is based in Nairobi in Kenya, covering East and Southern Africa, hosted by AMREF. We've got a hub that we announced sometime last year, covering Asia and the Pacific, in Malaysia, in Kuala Lumpur, hosted by IPPF. And soon, ladies and gentlemen, we will announce where our hub is going to be hosted in the Latin America region. The exact location will be revealed in a few weeks' time. This hub model, why for us is it important to evolve this architecture, is because FP 2020 then and FP 2030 now seeks to ensure that there is more contextual, locally driven responses to the need that we are seeing on the ground. Last year, we released our annual measurement report, where progress has been made to have about 87 million new users for modern contraception globally. We still have an unmet need for family planning. And this hub model seeks to create for us a global partnership that is driven by local priorities, with countries shaping our regional and global agendas, civil society, and importantly for us, youth, working with youth across the globe with their own governments and leaning on FP 2030 Hub to get the job done. Why are we coming to the Latin America and the Caribbean region? FP 2030 is new to this region, as many of you might know, but as an organization, we certainly are not new to the global fight to equitable, rights-based family planning. It's a complex agenda, but the reasoning and the why for us is very simple. This expansion to a more global approach that is localized through regional hubs has been a long time coming, and many of you, I'm sure, have actually thought about how that could look like in a few years' time. It will actually be different. So we are excited to hit the ground running in the Latin America region. We are inspired, ladies and gentlemen, and we are proud that 1 year into this new partnership, we have 37 government commitments to FP 2030, 79 non-governmental commitments, 17 of them from the Latin America region. If your organization has not made that commitment, please do reach out after this webinar is over. We know that the commitment and deep engagement of advocates like yourselves in this region will only make our partnership stronger. Why do we feel there is value in FP 2030 coming to the LAC region? We do hope that we can also contribute to the movement for inclusive reproductive health care in this particular region, and in being the world's only global partnership that is focused solely on contraception, on family planning. We've been able to galvanize progress by bringing together the right people at the right time from across the world, from across sectors and regions, to learn from each other. In fact, we do view that the Latin America region will also provide centers of excellence and would actually help us to provide the South-to-South learning that we often talk about in our work plans and in our strategies. We also offer some of the field's premier data resources. As I've alluded before, these include the FP 2030 measurement report with key family planning indicators based on our data partner Track 20. Their work on measurement in family planning is work that is led by experts in commitment-making countries who analyze data and always review progress. The report is now available in Spanish, and for me, this is progress and this is good news. So please feel free to download it, to analyze it, and to use it for your work as an advocate. It showcases high-level data in the region, and my colleague Jason, who is on this call today, he will present this analysis shortly. We do hope commitment makers can use this data for evidence-based programming in advocacy and ensure accountability of programs across the region, across the LAC region. Now, we know in Latin America, the data for me is interesting because it particularly shows some interesting stories. There are many indicators of success. For example, high modern contraceptive prevalence in the region, which we know already exists. But there is so much more to be seen. For example, a lack of a recent population survey data for the region can make analyzing data difficult, and I'm sure my colleague Jason is going to allude to this, and a high adolescent pregnancy rate still persists in the region. It is a region that all of you know has got many other challenges, including migration, and how do we respond to some of the challenges that are there. It is the collective pursuit for all of us to make sure we program appropriately to the needs that are emerging in the region. We are honored to have a panel of speakers today with deep expertise in the region that will help us unpack these issues further, guide us in the underlying question: what are the legal, physical, clinical, and social barriers to contraception for adolescents, for young people, indigenous people, and people of African descent? How do we mobilize the investment needed to ensure that contraception is in reach to everyone who wants it, whoever they are and wherever they are? So now, without further ado, I'll turn it over to Dr. Emma Margarita. I hope she is here. She is the Executive Secretary of the Salud Mesoamerica, and I know that is Salud Mesoamerica 2015 initiative, and it is managed by the Inter-American Development Bank, which is the IDB, and this is sponsored by the Bill and Melinda Gates Foundation. Ladies and gentlemen, the Carlos Slim Health Institute and the Spanish government are supporting this institution. We are also grateful to Emma's insights and support as we began our growth in this region. I'm excited to be here with you all today, and I look forward to the work that we will do together. And I just wanted to also salute my colleagues, Nora and Liliana, who have really done the heavy lifting of ensuring that FP 2030 hits the ground running in the LAC region. Over to you, Emma. Thank you very much.
Previo a las palabras de la doctora Emiriarte, simplemente extender una cordial bienvenida a todos los que
Thank you so much. We would like to welcome everyone who's connecting for accepting this invitation for the webinar. We have people from Central America, the Caribbean, and South America, and other regions. I would like to tell you that we will have the opportunity to listen to experts who will share their vision and the challenges having to do with family planning and reproductive rights in Latin America and the Caribbean. Without a doubt, this is the first of many dialogues of common interest where we know we have many pending issues as FP 2030 Alliance that coming to our region. It's a pleasure really to facilitate this space of dialogue that can be an excellent an input for the regional, national, and worldwide organizations and all the institutions that are present who work daily to advance reproductive health and including family planning. Thank you for the opening remarks of the Executive Director of the FP 2030, Dr. Lube. And now we give the floor to Dr. Emma Ariarte, Executive Secretary of Iniciativa Salud Mesoamérica, a very passionate woman focused on innovation, collective impact, and the different organizations involved. Dr. Ariarte, please, you have the floor. Thank you. Good morning to everybody. Greetings to all of you who work in this field of reproductive health and family planning. I will share some of the challenges that we have faced and the work that we have done in these years past, like Lillian and Samuel mentioned. In the different reproductive years, access to family planning and reproductive health are fundamental to improve health. Family planning services, information, and education not only allow women and their partners to choose the number and the time to have children, but also they protect human rights, women's human rights, and they bring them health benefits and their children. Family planning is the most efficacious intervention to reduce maternal and infant deaths. We all aspire to have this universal access to reproductive health and family planning. The capacity to control our fertility can also affect the powers of negotiation that women have in the home. And we would open more education and work opportunities for women that promote really economic development in our region. In spite of the important advances that we have made in this field, we still have unfinished agendas in the region. There are still barriers to have access, knowledge, and good practices in family planning. And these barriers affect us as women, they affect men and teenage users, but also as providers, we not always offer services without discriminating gender, social status. So we want to do this with greater evidence in depth. We have an unequal region amongst countries and within every country in Latin America and the Caribbean. The proportion of women who are sexually active, who do not want to be pregnant, who want to use family planning methods, are very far from being universal at the moment. Out of 19 countries that have data in family planning, only 3 have an index of 7% and 70%. We also have inequalities within the countries. In Guatemala, for example, the use of modern contraceptives is almost 30% more amongst the rich than amongst the poor. There isn't a universal access to family planning methods. In Latin America, the birth rates in Latin America and the Caribbean are the third highest in the world. In Nicaragua, we have 102 births for every 1,000. And in Chile, 22 for every 1,000 teenagers. So we need investment to increase services for men and for women and teenagers. It is a very important task of these governments to eliminate these barriers, the institutional barriers that present obstacles to the implementation of this intervention that is very important. So we have to include also other services to women and teenage girls. Other than clinical interventions, we have to make note to those who are having an influence and who are influencing empowerment of women and the collective view. We also need collective efforts for other intersectorial initiatives, and also to provide equality when it comes to family planning and pregnancies. And these issues, like Samu said, other than those issues, we have other challenges that need to be included in the region, like the support to immigrants, to refugees, violent situations, and humanitarian responses to emergencies and disasters. We have wonderful panelists, and we hope that this webinar will provide great feedback that will allow us to fight together more efficiently to improve the life and health of women, especially of girls and adolescents. Thank you so much. Thank you, Dr. Iriarte, for your unconditional support and for briefly, in your opening remarks, giving us an overview of the challenges that we face in the region. Speaking of numbers, we will continue with the presentation of Jason, who is Senior Director of Alliance FP 2030. And we also have other distinguished professionals that we will introduce later on and who will share their vision and their knowledge, and they will delve into those challenges and opportunities that we have in the region. Without much ado, Jason, please. Thank you, Liliana and Dr. Samu and Dr. Emma, for your opening remarks. Next, please, next slide. In the last 10 years, FP 2020 has published an annual report on this data. We have focused on 69 countries, the poorest countries in the world when we started the Alliance in 2012. Every year, this report analyzes the trends and the challenges for family planning using over 25 indicators, and we came up with country profiles. Now, this year or in this last report, for example, we use this data to show that the demand on modern contraceptives has been growing in spite of the COVID-19 pandemic and other crises like natural disasters, conflicts, epidemics like Ebola and Zika, political changes, and economic conditions. Next slide, please. So we established an annual measurement process that starts with countries reviewing their data, including model data, national system data for health monitoring, and reports regarding program financing. Now, with the FP 2030, we are continuing this annual process. But now, any country can be committed to this partnership. And this graph shows the annual process of adding, analyzing, and reviewing the data and to put together this report. Now, this flexibility amongst the countries has also created a problem, which is which countries should we start our monitoring and our report with? What is our baseline? Initially, based on our experiences with FP 2020, we decided to start with a report for the 22 low income and low to medium income countries. Next slide, please. There are only 6 countries in Latin America, including Belize, Bolivia, El Salvador, Haiti, Honduras, and Nicaragua. Now, this graph portrays the growth of modern contraceptive users from 2012 to 2022. So it's a 10-year span, growth span. And the number of users in these 22 countries has grown by 87 million people. But you can observe in this graph the regions, and the region of Latin America and the Caribbean, it's difficult to see, but it's green. It's very small. These are the only 6 countries in Latin America that are included, and we have limited visibility regarding the trends and the pending challenges having to do with reproductive health and sexuality in the region. So I believe that there is an opportunity to create that visibility in the region with donors, with the private sector, and with other actors. But at the same time, there are limitations for the region that have to do with the availability and accessibility of the data. Most countries have not had recent surveys, and therefore we don't have access to the database for a more in-depth analysis. Next slide, please. If we look at our current situation in the report, our FP 2030 report, with data including these 6 countries, only includes 7% of all people of fertile age in the region. This population from 174 million, half of which live in Mexico and Brazil. Next slide, please. These challenges don't mean that we don't have information to understand some of the regional trends. Through statistical models produced by the United Nations, we estimate a continuous increase in the use of modern contraceptives amongst all women and amongst married women. From 46% in the year 2000 to 56% in 2022 amongst all women of fertile age, and from 64% in the year 2000 to 71% in the year 2022 amongst married women. So that is a high level compared to other regions. Now, in comparison, the same numbers, including those 82 countries added to our current report, it's 35% for all women and 48% for married women. So it is higher in this region. But I don't have to tell you that these high levels of use hide other challenges. Next slide, please. Challenges which include a very concerning situation with the range of methods, high indexes of teen fertility, and disparities within the country, like Dr. Iriarte described. Now I'm going to use some data in the next slides to illustrate some of these challenges. First, regarding the most widely used contraceptive in the region, you can see in this graph the use of methods per specific method. You can see Latin America in the middle, and you can see that you have permanent methods in red are more common and very widely used. Also, the pill in green is very common. While in other regions, if we take a look at other regions, we can see that in comparison, there is much less use of newer methods like implants. Unfortunately, although there are advances in methods, the range of methods nowadays we could say that it's very similar to the ones that were used by our parents. Now here we can see this information for the 6 countries included in a regional report. This includes all the users and what methods they use. And although we only have these 6 countries, you can see the same trend here. Next, please. Regarding high fertility amongst teenagers, we can see on the left some averages for countries of different income levels. For countries of high income, we see 10.4 range. For middle income countries, 26. But for the region, you can see over 50 of a high rate of fertility amongst teenagers. For the majority, we have them in the category. We see that the rate is higher for middle to high income countries. And we have now research that say that in spite of the high use rate, we see that in the region inequality and the disparity depending on different demographic and geographic characteristics. And another problem is that we depend on out-of-pocket expenses for contraceptive use that contributes to this disparity. I think that we have to discuss how to give greater visibility to that inequality and how to monitor the fact that we are reaching our goal and to have universal access to reproductive health, universal access to all. Thank you, Liliana. Now you have the floor. Thank you, Jason, for giving us that brief review for that measurement report, 20FP 2020. Now, we go on with the presentations of the other panelists that we have announced before, and we will start with Dr. Catalina Martinez, who was a feminist attorney from Colombia. She's a litigant and with very emblematic cases. She is the regional director of the Centro de Derechos Reproductivos. Please, Catalina, you have the floor. Thank you, Liliana. Thank you. Greetings to everybody who has joined us today. It's an honor to be here for the Center for Reproductive Rights, and as a representative of the Center for Reproductive Rights, to be with you today. I will be very brief, and I will talk about the main advances that we have done in the legal field in Latin America and the Caribbean. I mean, we still have very restrictive laws regarding reproductive rights, as well as other difficulties in the legal frameworks. I think that we can say for sure, though, that in the last 10 years, the region has also made great strides in the field that, in a way, has turned us into a region where we can have a lot of lessons learned in the advances on the recognition of reproductive and sexual rights. I will try to cover a range of topics like capacity contention, abortion, reproductive health, amongst many others. And basically what I would like to mention is that I will speak of these advances, and finally I will talk about the opportunities that this landscape offers and some conclusions. Just a small detail of what I understand by what a legal framework is. I think it's important to know the definition. I will talk about the advances made by the Inter-American Human Rights Court. I will talk about laws approved by the states and also public policies and protocols that have been adopted precisely to guarantee and implement rights and access to sexual and reproductive health. Now we go to the first slide, please. This is the work plan of what I'm going to do. I'm sorry, I hadn't asked you to change the slide. Okay. Now we will begin by talking about the legal advances of the Inter-American system in the last 5 years. And I would like to begin by talking about the recognition that Inter-American Human Rights Court, when they talked about that the right to education also includes the right to sexual education. Paola, this is a case of Paola Guzman versus Ecuador. What does this mean? That the Inter-American Court gave this sexual education, it rose it to the level of a human right. So this includes this integral sex education talks about also the practice, like creating public policies that will guarantee that comprehensive sexual education. In this case of Paola v. Ecuador, the Inter-American Court advances a very important standard regarding capacity and consent that can be very useful in regards to teenagers having access to sexual education and reproductive education. Now, what they say is that teenage boys and girls enjoy a progressive autonomy to be able to make decisions that include their sexuality and reproduction. And that, of course, the exercise of this autonomy is very much linked to the fact that these people can have access to all the necessary tools to make these decisions, that they can have access to comprehensive sexual health, they have information on contraceptive methods, and also greater information. To have some examples, this is a very important standard that will allow us to get involved more actively in the discussions that are taking place in different states of the region in the face of parental authorization. For example, how far does the parental authorization go, and how far does that autonomy of the teenager goes? Now, it's another important issue has to do with professional development in Mexico. This is the case of Manuela v. El Salvador. In this case, the court established that within the framework access of services that are essential health services, we have to safeguard the professional secrecy. We have to include this in a region where most of these reports are made within this field. So the fact that the court is giving privilege of professional secrecy will allow us to have more or greater access to health services. And now I will talk about the fact that the court has asked that all the states in the region can incorporate protocols regarding obstetric emergencies that could happen in any type of pregnancy, that we have to detect them, and that those health professionals throughout the territory have to know what emergencies there are and how to tend to them. And another standard having to do with obstetric violence, that is to say, the Inter-American Court not too long ago, in a consulting opinion of those people who are incarcerated in a case called Brizas v. Argentina, they recognize obstetric violence as a verbal or obstetric violence that could happen during pregnancy, during birth, and after birth, which is gender-based. And the court is then mandating the states to adopt protocols and policies to have good quality medical care. And it's important to have this because it's really going farther from this vision of persecuting someone, which is not the solution. The solution is to have a structural overhaul of policies. Now, advances in legal advances in different countries, in different states, I will only mention a few because we're short on time. I would like to begin by saying that throughout the region, there are different states that are starting to think about public policies, sexual health, and reproductive health that are comprehensive. In Ecuador, for example, the implementation of PAOLA, the comprehensive sexual health, they are establishing protocols of comprehensive sexual health that could be perhaps applied throughout the region. It is in process. In El Salvador, we have the case of Manuela, the state of El Salvador. Now, El Salvador created two protocols, one on professional privilege and another on obstetrics. They have focused on improvements, and these are very important advances in matters of sexual and reproductive rights. In Honduras, where there is still a prohibition, emergency contraception. Not too long ago, a protocol was approved in the case of sexual violence, where they recognize the emergency or the morning after pill in the case of sexual violence. So in Honduras, we still have to include this provision. 1 minute left, please. We have also important advances. In Argentina, they legalized abortion, the decision Colombia that are very important because they are definitely setting different laws on how to have access to abortion at the regional international level. So the first few seconds that I have left, perhaps if we can go to the last slide regarding the advances. What are the different opportunities in the region? First, the human rights framework. I think it's of vital importance. For example, in the United States, they have really regressed in matters of abortion. In Latin America, the fact that our constitutions have incorporated human rights treaties as part of the constitution, this shields us so as not to take steps back, and we have to value it. And also different movements in Latin America and how they are creating public favorable opinions in these issues is very important. We cannot lose this opportunity. We have to highlight it, and I will close with the following: the commitment of many of the states in the region, Chile, Colombia, Mexico, now Brazil, Honduras, to be able to advance this reproductive health and sexuality agenda. We cannot miss this opportunity at the national level, but as well as how these states are present themselves in matters of human rights at the regional and international level. And with that, I will close. Thank you, Catalina, for this overview of the advances, the opportunities that are pending. Jason spoke of the importance of the facts and the data for decision making. And now, Fabiana del Popolo from Chile, she's my candidate of PhD in demographics and information regarding population in CELADE and CEPAL, with a very in-depth experience on the production, socio-democracy, advances and challenges in Latin America and the indigenous population and the Afro-descendant population. Please, you have the floor. Well, thank you so much. Good morning, everyone. Thank you, FP 2030, for your kind invitation. It is quite an honor to be here. Now, I centered my presentation on 4 questions. The first one is I don't see my presentation. Where are the slides? Thank you. Next slide, please. What are the factors that have influence in the persistent inequalities that particularly affect women, Afro-descendant, children, and indigenous populations? Next slide, please. Next slide. There it is. What we have to consider when we talk about these issues is that the legacy of subordination and exclusion, that colonization, conquest, and slavery that was prolonged in Latin America for almost 400 years in Latin America and the Caribbean. We have these state nations and we have a mold for structural racism. If we continue to make it racism that affects our region, we will not be able to make advances in matters of sexual and reproductive and health rights. This ethnic and racial inequalities that are at the structural level, they overlap with the life cycle, territory, and gender inequalities. It affects all rights, and in many life condition indicators are evident. We see here the rates of poverty. We see the gap in for example, in Panama, the indigenous population is 5 times as poor as other ethnic groups. The Afro-descendant population are twice as bad. So in this sense, these social determining factors have impact on the health of these groups. And we have to consider also the gap of the implementation to guarantee that political participation and cultural integration, which also puts them at a disadvantage to have access to health, to have health rights. The population of Chanomami, where the invasion and the territories, the environmental degradation, all the violence that arises from illegal mining, without a doubt, has impact on health and the life condition of these people, of this population. Now, second question. What is the evidence to be held accountable on matters of sexual health and reproductive health? Next slide, please. First of all, I think that Jason gave an overview on matters of information, the process of recognition that have advanced Afro-descendant and indigenous movements go hand in hand with census. And we can see that the introduction of these questions have been consolidated in this FP 2020 round, but we know that knowledge allows us to estimate infant mortality, child mortality, to analyze inequality regarding fertility and early motherhood. Well, we can also delve on matters of this lack of information and reproductive health. Now, we also have other issues like mix, and they have to do with the fact that they have other questions that have to do with ethnic identity. For example, with heads of household, but unfortunately, very few countries publish and publish this information for indigenous people and Afro-descendant people, even if they understand the question. And also, we have a matter of health registry, and the information systems are different. Next slide. We can see now that we are trying to update the information, and there have been many changes, reproductive changes in Latin America. For example, the global index of fertility has decreased amongst Afro-descendant and indigenous people. We can see this in the case of Guatemala, where fertility goes down from 7 children in 1987 to 3.6 in between 2014 and 2015. Now, these decreases go hand in hand with the increase of access to contraceptives, but we still have gaps. We have, for example, a different situation in the Amazon and the Andean region and different territorial contexts. Here in the case of Guatemala, we can see how the blue line is the observed fertility of indigenous women. The light blue is the desired fertility, and how we have a gap in fertility, unwanted fertility, that evidences lack of access to family planning. And in this graph, we also see how these inequalities are conjugated with reproductive ideals and reproductive trends that go hand in hand with the sociocultural ideas of the different population. Now in Guatemala, this yellow line is above the line of non-indigenous women, and this tells us that we have to consider in any policy or program matters of inequity, as well as matters that go hand in hand and that are not negative for women in terms of culture.
And recognizing that we still have lots of tension with individual rights and group rights that impact negatively to children and indigenous women, and that's one of our challenges. Regarding women, young teenagers that are going to be mothers, what we know is that it has actually decreased in indigenous women and Afro-descendant women. If we can go to the next slide, because I don't have a lot of time. Thank you. So what we see over here, the graph that we have here, the chart on the right side, is that we have recent census, like in Chile, the blue line is a decrease of teenager indigenous women that are going to be mothers. And with the exception of Colombia and the rest of the countries, we see a decrease. However, the lines, according to the last census, we know that we've had a decrease in indigenous women and maternity, but there's a lot of inequalities with indigenous women, and there's a lot of diversity in each town, and there are other elements that protect the culture and marriages in which it's not frequent to have kids when they're so young. But we also see that maternity in teenage women is really high. And then we see situations like Honduras, Panama, and Cuba where maternity in teenagers that are Afro-descendant is very low than the rest of the population. And we wonder if that's a reality or not. Thank you, Fabiana. Thank you for your presentation. Okay, next, we're going to talk about challenges. Next one. I want to stop right here, right here. And regarding international commitments, I want to highlight, and I don't have time to mention all of them, but I want to highlight the conference, the regional conference in Montevideo. And this agreement that was met has a specific chapter in regards to reproductive rights and also different measures for indigenous towns and Afro-descendant. And we talk about sexual and reproductive rights. And this year we're going to have a meeting. Last year we launched the digital platform and we are creating a survey regarding religion and politics with United Nations, and that's going to allow us and see how is that we can keep working on this Afro-descendant groups, immigrants, and indigenous women that are vulnerable. And next year we have the 5th conference. Next slide to close with challenges. Regarding politics, I want to highlight how important it is to strengthen different programs, intercultural programs, and reproductive rights and sexual rights in which we are going to respect this concentration of individual rights and collective rights. And in that sense, it's important to say that we have to exchange experiences and creating different diagnoses that can come from different indigenous population and Afro-descendant populations. And it's already happening in the region with indigenous women in different institutions like Chirapac in Peru. And it's important to strengthen the exchange of experiences, including different programs that United Nations support. And they have a lot of experience implementing intercultural programs regarding reproductive rights. And last slide, regarding information, I'm just going to summarize everything. We have to keep strengthening the inclusion of interracial questions, and it's very important to generate this, to be able to analyze these different indicators of health and sexual rights that could be measured according to different contexts of Afro-descendant and indigenous groups, and keep hosting and creating this type of spaces so that we could keep talking about it. And I'm going to end here, and at the end, I provide different links for different articles. So thank you so much. Thank you, Fabiana, for talking about this historic background with the Afro-descendant and indigenous backgrounds. And now we're going to Uruguay, and Rodolfo Gomez will talk in his presentation regarding reducing pregnancy in Latin America and the Caribbean. Dr. Gomez, since 2015, he's been in the Latin American Center for Sexual and Reproductive Health. Thank you so much for the invitation. It's a pleasure to be able to participate here today, and I hope that with this, we're going to answer some questions and also have some conversations in this experience. And I'm going to share with you some of these reflections regarding the reduction of non-intended pregnancies. So these pregnancies in a biological stage in which women are maturing has a great impact in their lives. And we see that this is something clear, and my colleague is going to talk about this. Federico will talk about this. And what is the financial impact? We know that teenagers that are in school but are not pregnant, when they start working, they get 10% more of salary. And we also know that pregnancy during the teenage years is more prevalent when the first pregnancy occurs at a young age. And we have here a publication from UNICEF, United Nations, and OPS. And taking this consideration of this framework that is going to help us with these different actions. Thank you. So I want to say that United Nations and different international organizations, we see that contraceptive methods are key. And like my colleagues say, I couldn't say it better than them. There are other elements. There's a legislation issue, and this was clear when Catalina was talking about this and Fabiana was talking about inequality regarding gender and racial inequality. And there's some information that we cannot really trust, and Jason was talking about this. And this is not going to allow us to get to any solutions and have public policies that can be neutral. And in this context, we see pregnancy in teenagers, and regarding the health issues, we have identified lack of direct training for different providers. Because here, if we want to have an international coverage, then we need to talk about this, because this is one of the strategies that we have seen and has had a great impact in the population, and also the inclusion of sexual and reproductive rights as a universal access to health. And that's one of the great and most important things regarding gender. So the identification of different needs of information and human resources was one of the strategies that we proposed, and we thought that we needed to improve and change. And at the end, I'm going to tell you which is the proposal to improve this and the health providers. And our region has a very interesting feature, and most of the cases, pregnancies are done in institutions, but in general, prenatal control has a lot of coverage. So most of the women that are pregnant have access to this. So it has some type of control in the second pregnancies, and we have called this. And abortion in general, if they have some type of complications, women have access to healthcare. So this group of experts and these organizations are in social society in 2017 were able to get online, and we don't know. It's not that we don't know what to do to reduce pregnancy. We know it, but the first thing we need to really talk about this and show where is the data, the most affected groups, especially qualitative information or data, and also showing all this information, and also empower young people and to stop talking about this inefficient interventions, and also to invest in different resources. And we need to show that we can strengthen the cooperation to be able to provide education to teenagers and to think about great programs at a large scale to be able to strengthen this. So if we have 7 elements, we're going to see, next slide, please. We're going to see that this is something that was done last year in 2022. This is called with Black, and we see here that even now, if we see the chart on the right side, we see that the proportion of women at a reproductive age that accept to take these modern measures are teenagers or young people. Teenagers are represented in yellow. So in this chart, what I wanted to show you is regarding the income. Even in the same country, you see that the red dots and that the green dots are really separated from each other. The more separated they are, more inequality there is. And we see the access regarding the places where they live, urban or rural areas. We see green, which is rural areas. And we see here what I was talking about. Okay, next slide. Next slide. Thank you. And we see here, we don't have a proportion, but the rate for every 1,000 births, how many of these are from teenagers? And we can see here that in the same country, taking in consideration this, where we see a huge increase is the differences in red dots. We can see the women that are pregnant are way lower than the women that are poor. Next slide. And here we see a recent article. Jason was telling us about the analysis of the 23 countries, and we can see here, we can see the needs of these modern methods and contraceptives. And this was just published. And we see that there's a group of countries, and it's 76% is lower. But if you click there, you can see the age as a very important feature that is going to show the difference with modern contraceptives of women of 15 and 19 years of age has only a 20%, 25% of the coverage, and older women has 73%. So just by belonging to this group of teenagers, this is going to say that they have less access to these modern methods. And even when they decide not to have more kids. One more minute. We don't have more to say, but there's a lot of inequalities. And we see a study here in the Caribbean, and we see that there's some women that have, so the OPS and CLAB responded with an initiative at a regional level regarding immediate contraceptive methods and family planning. And we also launched 2 virtual trainings that are in Portuguese, English, and Spanish, and now also in French, taking in consideration this. And training also different people. 14,000 were registered yesterday, and more than half already approved or passed this training. Another one is of direct contraceptives, and this is another training that was free in Spanish, English, and Portuguese, and now also in French. And this is very specific, this training for different doctors that attend pregnant women, and 18,000, more than half, already approved or passed this training. And I'm going to leave here the information if you're interested. Those are the 2 trainings that we have. They're free in the virtual platform or of OPS. And when they pass the test, then the manager of the organization signs it. And also, to generate all of this is key to be able to achieve what we want. Thank you so much. Thank you, Rodolfo, and every single person in the panel. I know that it's very difficult to be able to talk in 10 minutes with all this valuable information. And I also want to thank you for all the tools that you're sharing for everyone that is connected here, and we will share them later on. So now from Chile, to close the session of challenges, and we're going to talk about this with Dr. Federico Tobar, Regional Advisor for Health Systems, and he's to introduce one of the great topics, which is the financial consequences of pregnancy and teenagers in Latin America. Good morning. I want to thank you for the opportunity to be here with you and the progress that we have measuring the consequences that we have in Latin America. So I'm going to give you this conclusion where we implemented the analysis. These countries are going to lose 9.505 million every year, and that's 38 points of the GPD. And how do we measure this? We're going to go to the next slide. I propose two different stories so we can analyze it. One is micro and the other one is macro. This is the story of two girls that are born in the same country, same city, same street. They share the same dreams, they go to the same school, but their lives go in two different ways because one of them gets pregnant when it's a teenager. Maria is the one that got pregnant when she was a teenager. And what we have to measure here in this chart is that when they are older, at 34, Milena probably finished with the university and is at 24 years of age and is working. Maria has 2 kids and works in the informal market. So 26% is the difference in the income. This is high, and I'm going to translate this with Maria's life. If I multiply this at 100% and the income for 40 years of the working life, that's basically, and taking the words of my colleagues, we need to try to escape poverty so that women don't get pregnant after they're 24 so they can leave their kids in a different condition. Next slide, please. But how do we get to that? We don't measure the difference here. We also have to measure the participation in women that were mothers at an early age. They have more possibilities to go out of their house and to make more money. And we also measure here 2 different expenses or cost opportunities. The health care expenses and the expenses for Milena for health care are going to be lower because the risks of dying of the teenage mothers are going to be higher. And if we know that Milena is going to make more money, she's going to pay more taxes. So we also measure the differences in taxes. And now I'm gonna talk to you about the second story, and it has to do with this slide between Milena and Maria's. We see that in Guatemala we have 5 women that were mothers when they were adults.
Madre temprana. En Guyana la diferencia es mínima, es 1,4. Y aquí viene el principal hallazgo de esta segunda historia, pero se los quiero comentar. Primero les comento el hallazgo. El hallazgo es que el costo de oportunidad del embarazo adolescente es proporcional al nivel de desarrollo económico del país. Con lo cual es un error garrafal clasificar la tasa específica de fecundidad adolescente de acuerdo al nivel de ingreso de los países, por lo menos en América Latina y el Caribe. Y se los voy a explicar con 3 historias. Imaginen 3 países diferentes, no les voy a poner nombre, pero el primero es un país de una economía menos desarrollada, de base extractiva y de producción primaria de bajo valor agregado, donde la inserción laboral de la mujer es fundamentalmente en el campesinado, en una economía de subsistencia. En ese caso es indiferente si esta mujer, María, fue madre a los 15, a los 20 o a los 25 años, porque la condición de maternidad no afecta la modalidad en la cual ella se inserta en el mercado laboral. Imaginen un segundo país donde el sector manufacturero, el sector industrial, es el principal empleador. En ese caso, si seguimos, por ejemplo, los estudios de Cart y Angris, que ganaron el premio Nobel el año pasado en economía, es probable que cada año adicional de estudio de esta mujer represente entre 2 y un 5% más de
and
ingresos.
5% more of different income. Because in the industrial sector, the income from the workers, men or women, is proportionate. So if we think that a third country, for example, the country where I live, Panama, or any other country in the Caribbean, in which tourism is one of the main, in this case, the income for education is very high, but in Panama, we're gonna go to the next slide. And I don't know if you can see here, in Panama, the income is superior to that average that I was showing you. It's 39%. So women that were mothers at an adult age make 39% more than teenage mothers. Next slide. So you can see the difference here in this slide. And you can see how much they pay in taxes, women that were mothers at an older age. And I want to close with this. And the first thing that I want to share is my interpretation of this data. And I would here take the definition for sexo furtado regarding underdevelopment. It doesn't mean that underdevelopment is a model of growth. It's just that there's a part of the population that is outside of all the benefits of social growth, and who is that is going to be outside. And there's 20% of women in Latin America that have the same levels of education that their grandmothers had 50 years ago, or same income that their grandmothers had 50 years ago. So we are making progress, and we are actually, or we have two groups of women in which women try to finish their school and get pregnant later on, but we still have groups of mothers that are having kids before 20 years of age. But we have good news, and the good news is that pregnancy or teenage pregnancy, like Rodolfo was mentioning, the advantage of this is that the majority of the pregnancies are in different institutions, and they're non-intentional. And that's something that we can analyze. And now in 2019, we had a 65% of reduction of pregnancies in teenagers. So in 1 year, we could lower the rate at a 32% of pregnancies that are non-intentional. So these are Marias that wanted to be millennials in my example. So now we're going to the last slide, please. And these are different graphs. If we were able to incorporate 1,400,000 women to take birth control methods, then it would take 5 decades. But in 2 years, we could lower the rate of teenage pregnancies if we were able to do this. And it would also lower this unplanned pregnancies, and it would reduce deaths at younger at a younger age. And we need to invest to be able to do this $80 million, but for every single dollars, we would see benefit. And this would be centered in the women. So it would be $15 per woman. And we think this is good news. And I wanted to share this with you. Thank you so much. Thank you, Federico. And thank you. Thank you, Catalina and Fabiana and Rodolfo, our panelists, for all the words and information in this conversation. And we're starting in Latin America and the Caribbean. Thank you to all the organizations that have participated today. Now, Nora Quesada will give us a main session in this space, because now we go to questions and answers. Thank you so much, Liliana. We have some very interesting questions, and I think that the topics that we have talked about are very interesting for the audience. So someone here asks, Hilma, how can we work with different generations so that teenagers and young people can work together? And she's asking, how can we do that so we can guarantee sexual and reproductive rights? Could you respond, Catalina or Rodolfo? Of course, yes. Go ahead, Rodolfo. It's fine. No, it's okay. I can do that later. Okay, go ahead. Go ahead, Catalina. Okay, perfect. Well, I think there are different ways to do it, and there's some models with the movement of girls and teenagers, but it's very important that girls and teenagers are involved in every project or procedures so that they are involved in this type of programs regarding their rights. And we need to do that. And I'm going to provide two examples on how we are working on these models. Regarding Paola Guzman and sexual education, we have created in Ecuador a working team with two different organizations that work in reproductive rights, but there's also some organizations that work in childhood rights. And this team is the one that is working with the authorities, with the government, so that we can create this protocol for sexual rights, and it's an education model. And in this way, we are basically working with the girls and young people in a very good way. And also we have another campaign which is called Children That Are Not Mothers, to prevent pregnancies, unwanted pregnancies. And we are doing this in different regions. Thank you so much, Catalina. This question goes to Rodolfo now. What are the inefficient visualizations that you're talking about? How can we provide some advice on how to improve work with UNICEF or UPA that talk about this type of subjects? Thank you so much. Well, I want to add something to what my colleague was saying. There's some successful experiences, and when we talk about methodologies that have been developed by OPA to create some dialogue with different cultures, with different generations. And we have used this in Honduras and Dominican Republic, and with funds from the government of Andalusia, we initiated a strategy for teenage pregnancy. So there's some tools that are used with the government and the health department and other actors, and also with different parent groups, and also involving parents, mothers, fathers, so that they can really reduce violence. And there's a strategy that it's called Strong Families, and it has been implemented in Latin America and different countries in reducing teenage pregnancy and the increase of pregnancies. And there's also evidence, and there's a website that is called HIP, Impact Practices and Family Planning. And if you want to have a very clear vision about these practices that have a very strong support to be implemented, I really want to recommend this website. It's translated into Spanish and other languages. And in our club, we have translated all the documents in Spanish, and the description is there for practice of inclusion in telemedicine, websites, in different contexts. And there's a question here, and I'm gonna take it really quickly. What about inclusion of men? If we don't bring in young men, then this is not gonna work. But if we are including them, then the success is going to be higher. And I also had a meeting in Geneva last week, and we analyzed some contraceptives that are new contraceptive methods, and they're experimenting with them. And there's one that is being tested in Indonesia for males. It's a spray, and you put it on men, and it absorbs through the skin, and that lowers the quality of the sperm. And they're still experimenting with this, but we still have a long way to go to be able to put it in different clinic trials. But there's not a lot of development in contraceptives for men. So, and I'm gonna end with this. Thank you. Thank you so much, Rodolfo. And this question goes to Fabiana. What efforts are there out there, or information about how to treat people that have different disabilities? Well, thank you so much for the question. And to tell you the truth, we have a lot of gaps of information for indigenous groups and Afro-descendant groups, but for people with disabilities, it's even worse. We really, like, in the same way that we are promoting inclusion or inclusiveness in different races, we're doing a similar job with people with disabilities. So there's not a lot of information. And however, because we are in the process of creating different reports, regional reports to implement the agreement in Montevideo, we're gonna keep working to be able to gather all the information that we can, so that when we present the report, we can also talk about people with disabilities. Thank you so much, Fabiana. And this question goes to Federico. The access of contraceptive methods to teenagers is key, but what's the best way to make them accessible to them? Well, I think the question is for all of us, not only for me, but My perspective is that the evidence that we have and that we've seen more useful is that the access of contraceptive methods at a long term is better in teenagers or for teenagers. And there's a trade-off regarding one of the concerns that we have seen regarding involving males in these contraceptive methods. And I think that prevention of pregnancy in teenagers and using condom is not very efficient, or because of what we have observed, less than 5% of the cases we are preventing pregnancies with condoms. So it's not very efficient. The most efficient thing is to keep working on long-term contraceptive methods. In Argentina, we've been able to lower pregnancy rates through a strategy that uses 3 different methods, which is information in schools and then access to contraceptives at a long term, and also to advise and counsel children in schools or community centers so that this incentivize women and they don't have to wait in long lines to be able to get contraceptive methods. So with that type of strategy, we can have a direct impact. And another trade-off would be mobile units. Haiti, which is very poor, has lower rates of teenage pregnancy because of the strategy of mobile units. And girls know that once a month there's going to be a mobile unit, and even if they have to wait in long lines, they're going to have long-term contraceptive method. Thank you so much, Federico. And last question, briefly, Jason. Why they only talk about contraceptive methods for married women when there's also a responsibility for men too? So briefly, please, so we can close the session. Thank you for the question. The advance or progress that we've seen in the last years is not concentrating only in married women, but also all types of women that are in the reproductive ages. But we're still measuring with different surveys the use of contraceptive methods amongst women. And the surveys talk about these women, and the questions are only for women in the majority of the surveys. So the questions are if they or their partners have used something to prevent pregnancies, and we are measuring the use of condoms, of vasectomy, but we are always asking only women. And we say women and not all genders. And we know that there are some challenges regarding our data and the gender issue. Thank you so much, Jason. The questions that are still pending are going to be answered with the support of the panelists. We want to thank you again for all your presentations, and now I'm going to allow Marta Arroyo to say a few words. Thank you, Nora. I want to thank all the panelists, all the people that were here today, the team of organizers and SAMO for FP 2030. And as a member in 2030, I want to invite to strengthen the dialogue amongst all the actors regarding the priorities to see where should we continue working with this agenda. There's a lot of information, very relevant information. Questions and answers show that, and I want to highlight some points, not the only ones. And I want to say that this family planning has a lot to do with these elements. Jason talked about the data and how important this is to be able to define and create better programs. And I was mentioning also that Catalina was talking about advancing with the legal framework in different countries. So these are 3 points that are very important. And also the strong movements in Latin America, and also leading this sexual and reproductive rights. So this is a great task, and I think that we all think that we need a lot to do to be able to understand these groups, indigenous groups, Afro-descendant groups. So we need more information to be able to adjust our responses better. Rodolfo, pregnancy in teenagers is painful. We see lower rates, but we also need to be careful with this average rates, because there's 7 concrete actions to be able to keep working in this situation that is very painful. And Federico is talking about that and how lives take different paths between Maria and Millennia, 26% and the average of income. So how can we talk about these effects with pregnancy, and what we need to do to continue with this rate? So thank you so much for your information, because that shows that there's a lot of knowledge and the experts are great in Latin America. So we're gonna keep working in 2030 through the hub that is going to be launched. And we want to invite different experts to continue sharing what they have identified, like challenges and opportunities and knowledge analysis, because this is very important to keep moving forward for human and sexual rights. So thank you and have a wonderful day.